Assalamu alaikum. Today we are in the MCPS class of Isra University, and it is 17th January 2025, and we are discussing a very important public health issue, and the common name is HMPV. HMPV. H means human, and M means meta, and P means pneumono, and V means virus. And you can see there it is human, meta, pneumo, virus. Human, meta, pneumo, virus, and this is sometimes written H, big H, but here the nomenclature is small h, then MPV. And we have taken this lecture from net, and I am thankful that the author has given a lot of information, and we are using this for our lecture purpose. And I have taken this from one of the available doctor presentation, and the name of the doctor is Professor Dr. Al-Khani. Is from UAE. So thank you very much, and we acknowledge that we are using the material of that professor here for the public interest. Otherwise, this knowledge is for the public consumption and for the public use. Next, please. It is RNA virus. That is the main message in this slide. Next. And you can see that these illnesses are neither clinically nor radiographically distinct from the same clinical syndrome caused by the common respiratory viruses. So, if you take X-ray and if you check the patient, the symptoms are cough, cold, running nose, difficulty in breathing. So HMPV can cause severe infection in immunocompromised, those who have less immunity, and transmission of HMP is important, like occurs via respiratory droplets. So same as the COVID was the problem, the same problem is here, secretion, and similar to RSVP, respiratory syncytial virus, which is very common, pneumonia causing upper respiratory tract. Next, please. HMP was first described in 2001 by Dutch investigators, but now latest media is reporting that this virus is spreading very fast from China, and many countries are thinking that this may be an alternative to the COVID pandemic, and this may cause, and there might be certain changes because this was described in 2001. So in last 23 years, this virus might have some genetic changes, so it may cause a serious disease, as well as these are the viruses basically from the animals, and they jump to the human population. And the pneumovirus subfamily of the paramyxovirinae that includes respiratory syncytial virus, I have already told. Next, please. Hospitalization can occur more common in children or adults with underlying conditions. Prematurity means early birth, asthma, immunocompromise, and cardiopulmonary diseases. And the spikes are also visible when you see in the microscope this virus. The spikes are same as we have observed in the COVID also. Next, please. This is epidemiology, and glycoproteins are visible in viral membrane, and extrudes nucleocapsid is visible below. So you can see the morphological picture or microscopic picture. Next. Annual epidemic during the late winter, and occurs 1 to 2 months later than the peak of RSVP, means respiratory syncytial virus. The percentage of HMPV detection varies from 6% to 6% to 15%. But now the danger is of the pandemic, or just like the COVID problem we have faced in 2019 till 21. So 2-3 years we were fighting with the. Next please. The peak hospitalization is in the 6 and 12 months of age, and higher rate of underlying diseases. If there is any other disease, then this infection will be more serious. Next please. Upper respiratory tract symptoms include running nose, cough, fever, conjunctivitis, vomiting, diarrhea, rash are occasionally reported. Next. Lower 21. So 2-3 years we were fighting with the. Next please. The peak hospitalization is in the 6 and 12 months of age, and higher rate of underlying diseases. If there is any other disease, then this infection will be more serious. Next please. Upper respiratory tract symptoms include running nose, cough, fever, conjunctivitis, vomiting, diarrhea, rash are occasionally reported. Next. Lower respiratory infection, bronchitis means dry cough, croup means cracking sound, and pneumonia, asthma, exacerbation. Next. Infancy, this is important. Bronchiolitis means bronchioles, small bronchus. Pneumonia, croup, exacerbation of asthma, upper respiratory tract infection, acute otitis media. This is important. You can have a pain and infection of the air also. That is different from COVID and many other diseases. Next please. Older children, same. Laryngitis is important. Croup, bronchitis, asthma, pneumonia, and exacerbation of chronic obstructive pulmonary disease means a long difficulty in the breathing or not responding to the normal antibiotics. Next please. Diagnosis, no specific diagnosis, but PCR, RT-PCR, real-time PCR, polymerase chain reaction assay can diagnose it. Next. Treatment, the majority of children HMPV can be managed with the supportive care. Hospitalization, oxygen may be required, intravenous hydration, bronchodilator, corticosteroids, and ribavirin and polyclonal human immunoglobulin that is necessary. So antiviral drugs and immunoglobulin can also be considered. Next. Prevention, this is important, and recombinant HMPV strain that lack various genes, highly immunogenic, inducing neutralizing antibodies and protection against challenge with wild type HMP. So it has two types, wild type and human type. So we are discussing human types, but in the China, this might be a new variation or new type of this. Several potential vaccine candidates are developed within 3 years of the discovery of HMPV. So still we don't have such a vaccine facility in Pakistan. But as this slide and this lecture was many years ago, so now HMPV vaccine might be available, or it might reach soon, and we may control and prevent this disease. Next please. Thank you very much. Please like it, share it. Dr. Hussain Bashpolachi will give you a public health lecture series for the community medicine who are interested in public health and various courses of MCPS, FCPS, MPH, even PhD or MPhil. So you are welcome, and the purpose of this lecture was to create awareness among the population, medical students, doctors, and give them insight that a new threat, public health threat, is reported in the media. So Pakistan and the healthcare system, and particularly in the Israel University, we request that the use of the mask, early diagnosis, and if such cases which are HMPV like symptoms, please take care that this new virus is entering, and we must be vigilant on this. And the government of Pakistan may soon notify, and we may have screening at the airports and other countries' borders. Thank you very much.